Hyphema is accumulation of blood inside the anterior chamber of eye. Common cause of hyphema is trauma, and the source of bleeding to tennis ball injury to an eye and blunt trauma to eye is Circulus Iridis major. Pupil is the opening at the center of the iris, and the iris adjusts the size of the pupil to control the amount of light that enters the eye. Circulus iridis major can be seen at the root of the iris, and the circulus iridis minor can be seen near the pupil. The posterior long ciliaries can be seen here, and the anterior ciliaries are present here. Both travel anteriorly to join the major atrial circle of iris, that is Circulus Iridis major. Now we can see a question that is related to the discussion. Epistaxis is also called a nosebleed. Source of epistaxis in Little's area is sphenopalatine artery. Sphenopalatine artery is the artery usually responsible for refractory epistaxis. Here is the posterior and anterior ethmoid artery. So the anterior ethmoid artery, posterior ethmoid artery, sphenopalatine artery and septal branch of superior labial artery, and finally the greater palatine artery or the 5 arteries anastomosis in an area. That area is called the Little's area or Kieselbach's area. Now remember, the source of epistaxis in Little's area is sphenopalatine artery. Here is the Little's area or Kieselbach's area, and this is the sphenopalatine artery. We are going to see the vessels that supply tonsils and the vessels that can bleed after or during tonsillectomy. The lingual artery, facial artery and the maxillary artery. The maxillary artery gives rise to descending palatine artery. The tonsillar branch of ascending pharyngeal artery coming from the ascending pharyngeal artery. Here is this, and the facial artery gives rise to ascending palatine artery and tonsillar branch of facial artery, and the vein that drains the tonsil is paratonsillar vein. So the tonsils are two round fleshy masses in back of your throat. Tonsillectomy is a surgery to remove the tonsils, and today the tonsillectomy is usually performed for sleep disordered breathing but may still be the treatment when tonsillitis occurs frequently or does not respond to other treatment. And the main source of bleeding in tonsillectomy is paratonsillar vein, ascending palatine artery and the tonsillar artery. ட்ரெக்கியோஸ்டோமி அப்படிங்கிறது ட்ரெக்கியாவில் ஒரு சின்ன ஹோல் க்ரியேட் பண்ணி அது மூலயமா லங்ஸ்க்கு ஏர் சப்ளை பண்ணுறது. இங்கே திஸ் இஸ் தி இன்டர்னல் ஜூகுலார் வெயின் அண்ட் த superior thyroid vein and middle thyroid vein drains into the internal jugular vein on either sides of the neck. But the inferior thyroid vein, this one, the inferior thyroid vein drains directly into the brachiocephalic vein. This one is the left brachiocephalic vein, and here this is the right brachiocephalic vein. Left and right brachiocephalic vein drains into the superior vena cava, and the blood from superior vena cava drains into right atrium of the heart. So here you can see inferior thyroid vein and isthmus are closely related to anterior surface of trachea. When we are creating an opening into the trachea from the outside of the neck, these are the structures that may get damaged and bleeds. So, isthmus and inferior thyroid vein are the main source of bleeding in tracheostomy. Hemoptysis is coughing up blood, and bronchiectasis is a condition in which the lungs airway become damaged and making it hard to clear mucus. So the most common source of bleeding in hemoptysis and bronchiectasis is bronchial artery. Here you can see the trachea, and behind the trachea esophagus is present, and this is the arch of aorta from which the bronchial artery comes and supply trachea and bronchus. This is celiac trunk. The three major branches of celiac trunk are: the first one, splenic artery that travels posterior to the stomach, and this is left gastric artery gives off esophageal branches to supply lower part of the esophagus. This is common hepatic artery from which gastroduodenal artery arises and supply duodenum, from which the right gastroepiploic artery comes, while the left gastroepiploic artery comes from splenic artery. So this is gastroduodenal artery coming from common hepatic artery, and the right gastric artery coming from proper hepatic artery supplies pylorus and lesser curvature of the stomach. And now this is celiac trunk, this is left gastric artery, and this one is gastroduodenal artery. Here this is right gastric artery, and this one is splenic artery. So the most common source of bleeding in gastric ulcer is left gastric artery and splenic artery. Here this is the gastric artery, that is left gastric artery, and here this one is splenic artery. Then the most common source of bleeding in duodenal ulcer is of course gastroduodenal artery. The most common source of bleeding in hysterectomy is internal iliac artery. This is uterus, and here this is abdominal aorta from which the ovarian artery arises and supply ovaries. The abdominal aorta divides into two common iliac artery on either sides, and the common iliac artery divides into external iliac artery and internal iliac artery. The internal iliac artery gives off uterine artery and vaginal artery. When the hysterectomy taken, that is the surgery to remove the uterus, this internal iliac artery have higher chance to bleed. So the most common source of bleeding in hysterectomy is internal iliac artery. The most common source of bleeding in menstruation is spiral artery. Here this is the uterine artery, and from the uterine artery arcuate artery arises, and from arcuate artery radial artery comes, and the radial artery gives off spiral artery, and here this is the spiral artery which is responsible for bleeding in menstruation. Now let's answer the question: what is the main source of bleeding in tennis ball injury to the eye or hyphema? What is the main source of bleeding in epistaxis in litters area? What is the main source of bleeding in tonsillectomy? What is the main source of bleeding in tracheostomy? What is the main source of bleeding in hemoptysis and bronchiectasis? What is the main source of bleeding in gastric ulcer? And what is the main source of bleeding in duodenal ulcer? What is the main source of bleeding in hysterectomy? And finally, what is the main source of bleeding in menstruation?